Trying to load. Okay, hello everybody. This is Cedric Crumley. I have my dentist, Dr. Dadashyan, on the line. Hello, Dr. Dadashyan.
Hi, how are you, Cedric?
Oh, I'm good. Like I was just telling you, I wanted to get this on recording because I interviewed you before. I think it was in 2014. And I didn't share that interview, but this interview I want to share with people and let them meet.
My pleasure.
Yeah, I want people to get to. Actually, I want to hear your story. Can you tell me your story of what made you decide to be a dentist?
Oh, we're going back to my childhood, actually. We had a family friend of ours, a dentist. And we basically, my sister and I were going to the same doctor, to the same dentist. And both of us had completely different experience with the same doctor. My sister till now can tolerate dentists, and I'm very good with it. So that part of it actually what made me think about it. And basically when I grew up, I was going to help him as an assistant actually mainly. And yeah, I grew up among, actually we had a couple of more dentists around, a family friend. And basically I grew up among dental group, let's say. I think that made me make this decision. And also, actually, I like working with hands. I like fixing and helping people actually enjoying their smile.
Oh yeah, yeah. And I can tell that visiting your office, you enjoy what you do.
Oh, I love it. I truly do.
Yeah. So what's it like being a dentist?
Being a dentist?
Yeah, what's it like?
It's fun. It's fun. It's sometimes hassle, but you always have to be on top of it, and because there's no exactly the same case you're gonna meet. So there's always things you need to keep in mind and consider what's the best for this particular patient. In terms of everything, actually, a smile, restorations, depends on what type of restoration the patient is willing to do. So yeah, I mean, again, I love it, and it's constantly, as I said, there is no exactly the same case, so that's why you constantly have this thinking process, which I love. And in the end result, the most important is the end result, as long as the patient is happy.
Mm-hmm. Yeah. And oh, I got to tell you, I appreciate it. I can't remember what I had to see you for, and I was so nervous. I had to have some procedure, and you just said, "Hey, does this make you nervous? Are you afraid?" I said, "Yeah, I'm scared, man." And I can't remember what it was. I think I was scared of the needle, right?
I think so. Yeah, as I remember. You're talking about the first time, right?
Yeah.
2013 or for end of 2013 or beginning of 2014. Yes, as I remember.
And you was very patient with me, and you did a good job without the needle, and I was like, wow, this guy's amazing.
Yes, thank you. Trying my best. There are a lot of patients actually are scared mainly of either a needle or the sound of the handpiece, the machine.
Yeah.
So with the sound of the handpieces, I cannot do much, unfortunately. But with the needles, there are techniques when you can make it less painful, less sensitive, which helps a lot.
Yeah. So tell me, what was your biggest fear before you started your practice?
The practice as a business, the business itself. Because I've had pretty good experience already previously before I stepped into the having my own practice.
Oh, okay.
But the business side of it is, it's something what we all actually have to learn while we go.
Okay, what did you have to learn? Tell me what you had to learn.
Dealing with with staff, Then advertisement. Advertisement is never-ending process, learning process. Till now, there are I've done quite a few advertisements, and I know a lot about it, but far from everything.
Okay.
So there's always, things to learn.
So have you found some things that are working better than other things?
Mainly what I'm focusing now is word of mouth, which is the best advertisement.
Okay.
You do a good quality job, people talk about you. I have quite a few referrals from my patients. And another thing which I just started, unfortunately late, but better late than never, I started up my website finally. I focused, I know, but I focused on the Facebook a lot for some time. But right now I want to do Google Ads. I want to try at least Google Ads. And one of the requirements is a website there, of course.
Yes, yes.
So yeah,
website and a good
that's where we are. Yes, exactly.
Yeah, look at you. You
we
are
do have a web
of it. That's good.
Yeah, I'm trying. But there was a lot of waste of time and energy for advertisements, which didn't bring anything.
Right.
And but yeah, as I said, you learn as you go.
You're right. Yeah.
Basically, the main even problem, I would say, in business is advertisement.
Advertisement. Okay.
To me at least.
As a guy that helps clients, that's a problem seems to be throughout the industry.
It is.
Yeah, I get.
But I have a lot of dentist friends, and whenever we meet, we all, share experiences. And the thing is, what I noticed is every location, every doctor, it's all different. In one place, one advertisement can work very well, but in my location, for example, in my city, it doesn't. So
Right.
you have to learn again, just specifically for this location, I would say.
Yeah, there was a famous, I think it was John Wanamaker that said 50% of my advertisement is wasted, but I don't know which half that is. But yeah.
It's true, because we're trying to keep track of it, but it's hard. It is hard. Yes, I agree.
All right. So on average, how many hours would you say you work a day?
About 8.
8? Okay.
Sometimes if we're running late, yeah, about 8:30. Yeah.
Okay. If you could name one thing that would make you happy right now, what would that be?
Happy?
Yeah, what would make you happy?
In the dental field.
Or just in general?
In general.
Yeah.
In general, having good family.
Yeah, that's right. You are a family man.
Everything else comes along.
Yeah, and I think it shows when I go to your practice. Your practice feels like a family when I walk in there.
Yeah, and that's how I'm trying actually. And thank you for the compliment. And I'm trying to get the stuff accordingly. Yeah.
Okay. If you could destroy one myth about dentistry, what would it be? Or one myth about dentists, what would that be?
Causing painful, procedures. Or if it's about dentists themselves, it's just that they're causing pain. My majority, I would even say, of my patients when they come, even they have high blood pressure. So they have white coat syndrome, if you've heard of it. And or they're very scared of dentists.
Oh, when they see the white coat, their blood pressure shoots to the roof.
Oh yeah.
Okay, yeah, I've met some people like that. Yeah.
Quite a few.
Yeah. Do you have any books or courses you could recommend to help other dental professionals? Or what helped you? Are there any books that helped you in particular?
I'm trying, depends on what the dentist is focusing on.
Okay.
Not right now, for example, I'm focusing on implants,
Okay.
placing implants. So I had a course actually taken in October, like a couple of months ago. I went to Alabama. It was a great course. I would always suggest them. This course not only had great lecture, it was 1 week course. So about 2.5, 3 days we had the lecture only, and after that we placed implants on a live patient, which breaks this fear if anyone has.
Okay.
So it's good. The book for implants, for example, is the best book, at least what I've read, was the author was Carl Misch. He's very, very famous in the United States, actually. And I believe even outside of the United States, he's very famous for as an implantologist.
Okay. Wow. What was the name of the book?
Complementary implant.
Okay. Wow. Okay. So my last question, this is my favorite question. What question do you wish I asked you, and what's the answer to that question?
That's not easy. The question probably I would ask you what's the best advertisement on average?
I tell you what, go ahead.
Yeah, I mean, the best, we talked about it a little bit already, the best is word of mouth. Besides word of mouth, what is the best? And I don't have an answer.
Well, I'll tell you from my point of view, from doing some marketing and selling for my own stuff, what I do, there's something called direct response marketing. Have you heard of that term?
No.
So it's where you do marketing, but everything is measured. Everything. And you test everything. You test your headline, you test your wording, you test the media that you use. Everything is tested. And so right now, I'm doing some things, and an easy example for its testing. I'm using something called MailChimp. You heard of MailChimp? It's an email subscription.
Yeah.
So I did a test just yesterday, and I wanted to see the best time to send emails. Is it 6 a.m., 12 noon, or 6 p.m.? But I'm finding out most people are reading my emails at 6 a.m. And I found it out by doing a test. So direct response marketing tests everything. So there's no guesswork. It's scientific. Matter of fact, a very good book is Scientific Advertising by a guy by the name of Claude Hopkins. He was like, I think early 1920s or something like that. So, yeah.
That's good to know.
Yeah. And
I know I followed you. I'm still following actually, and mainly on Facebook.
Okay.
But you're doing good. You're doing good.
Thank you. Thank you. I also want to thank you. You know, I don't know if you know it or not, but you encouraged me before I even wrote my book. I let you read a chapter from my book, and you encouraged me to continue on. You kept saying, when are you going to finish your book? When are you going to finish your book? So I appreciate it.
Yeah.
Yeah. So I wanted to let people know how to get in touch with you. How can someone get in touch with you? They want to find out more about you and your practice.
Basically, for now, since unfortunately, we don't have a good website. We have a website, but it's not, up to good standards yet. So I would say the phone number to the practice is 281-446-6527, or on a Facebook. We always respond within an hour. Humble.dental on a Facebook.
Okay, got it. All right. I'll be sure to put that out. So that'll wrap up this meeting. And thank you for attending. Hold on after the call. Hold on.
Sure.